Okay, now Andy Bogdan from Henry Mayo Hospital. Let's give Andy a big hand also. I'll go bring your presentation up.
Thank you, Alan. Alan, thank you very much for inviting me today. You know, I used to drive by this location quite often on my way home, and I'd always wanted to come into the Moose Lodge, so this is sort of a double treat for me. I'm going to give you an overview about the hospital, and I've worked at the hospital for 10 years, and as the Director of Planning, Marketing, and PR, I had an opportunity to not only get very closely involved in some of the research and decisions about the growth, but also about how we would explain it to the public. So I'm hoping to give you a point of view that you might never have otherwise had an opportunity to hear from the inside out. And even in driving past this lodge, I often wondered what folks thought about the hospital, and so this is a really terrific opportunity for me to get questions from you later and some feedback. We're going to talk to you about some of the change in the past 10 years, some of our accomplishments during that time and recently, and our mission, which is incredibly important. Usually I start there, but we made some recent changes in our mission that I think you'll find very interesting. And some of the challenges that we're going to be facing in healthcare, not just at Henry Mayo, but throughout. And you've probably heard some of those things related to reform, and our immediate goals and time for question and answer. But in terms of change, just very briefly, in the past 10 years, what we did 10 years ago is we restructured. Some people have a memory of that, but it was extremely important for the health of the hospital. Being the only community hospital here, we had to make sure that we could sustain our existence and provide for the community, all of the community, and particularly on this side and the outer edges. We had to be large enough and healthy enough, and we did that. And during that time, one of the first decisions that was made at an executive level is that we needed to increase or adjust the payment wage, the wages for nurses, because they're so essential to the running of the hospital and taking care of you. So we did that despite the fact that we didn't have a lot of resources at that time. We thought that was an essential first step. And one of the first things my boss asked me to do during that time was to recruit nurses. So I personally can't take credit for the 275 nurses that have been recruited since then, but we've more than doubled the number of nurses in the facility to care for you, and I think that's an extremely important change. But also, in the last couple of years and in working with COC and in reaching out to the community, we've added a lot of new positions and a lot of new clinical specialties to the hospital. We have an amazing IT department that continues to grow because we're putting in an electronic medical record, growing our admitting staff, and we have also new positions that we've never had before, such as nurse informatics, informaticists. These are nurses that specialize in computers. So as our industry grows and as your needs change, we're bringing in more people with special talents. Competition. You know, in the last 10 years, one of the things that was really important for us to do is to behave as if we're competing. We're in a community that's a little bit isolated from the rest of LA. Anybody who lived through the earthquake knows about that. And with that geographic isolation can come a sense of separateness from other hospitals. And we knew that in order to do the best work for you, we have to compete. Well, how do we compete when there isn't anybody down the street that you're choosing against us? Well, we create the opportunity to look at databases nationally, to invest in surveys where we can compare ourselves to other hospitals. And so we've been very aggressively looking at all of that information and making sure that we are as good as, if not better, than other hospitals across the nation or in California, and I'll talk a little bit about that. And there are some areas that we still have to work on, but it's very important in our care for you. And planning in terms of clinical and infrastructure, bringing in new services, which I'll mention, the electronic medical record, and expanding the facility. And I'll show you the model in a couple of minutes. Because we've made a lot of progress in our planning on the new facility in terms of the additional building. and investment. We continue to put more investment into not only the people and the development of the people that work there, but also into the infrastructure so we can bring you the best. Our particular hospital is not part of a mega network. We don't let that intimidate us that we're not part of a mega network. The majority of our nurses actually live in this community, and we are all about this community. So we think actually it's an advantage because we're 100% focused on the Santa Cruz Valley, and the decision making is local, and all of the money that we earn goes back into this facility and not into any others or into stockholders' pockets. So that we think is important. But in terms of accomplishments, we've completely redone our imaging services. That is extremely important if you're a physician. Your physician needs to have absolutely the best equipment to look at images, be able to diagnose you. And the electronic medical record is going to allow us to get information in real time. And again, all that data that can help us compare so we can see how we're doing, not only internally but externally. And that's the advanced clinical systems mentioned here. We are in the top 10% nationally in our outcomes, in our scores on the public report card for heart failure and heart attack. That was a goal that we actually hit. The parking structure has been built, and the helipad for trauma services is going to be open soon. So the data center sounds like a small thing, but it's very important in a disaster that we are able to continue functioning. We made that investment, and the facility itself has been completely retrofitted, and that did have a lot to do with the financial problems we had 10 years ago, but for the benefit of the community, it's incredible. Your community hospital is one of the first in California to complete its retrofitting, and that's an investment that a lot of hospitals did not make for a very long time, or still have not made. So, and it's a very little known fact about Henry Mayo. We did grow the ER. We had a very successful capital campaign from the community, which we appreciate, and we did increase the size of the ICU. And that is 50% larger, and it's state-of-the-art. It's absolutely beautiful. So that for the most critically ill, these are important changes at the hospital. We are accredited as an advanced primary stroke center by the Joint Commission. That means that we are also part of the stroke network in LA County. If you have a stroke, the paramedics know that they can take you to us, and we're prepared to do the best possible work for you, and not everybody can be in that network. You have to earn that through the Joint Commission and with LA County. And then we also opened up a cardiac cath lab. That is the beginning of a cardiology program where we can provide interventional services that can save your life, and it's just the beginning, and it's something that we're very excited that we're going to be able to provide. And it's a part of being competitive that we had not been in the past. So as much as we have been looking at others are now looking at us in a different way, and we think that's good. I mentioned that we've more than doubled the number of nurses in the last 10 years. We've added outpatient therapy locations and lab locations, making that more convenient for you. I told you about the imaging expansion. We've improved our security services. Coming on the heels of Sergeant Harris's presentation, we understand how important safety is at the facility. So now you do have to get a badge to visit somebody. We think most of the people that have come feel that's really an advantage, and they don't mind stopping and signing in because it's safety for everybody. Our earnings have been strong. That is not that common in California. The cost to run a hospital in California is higher than in other states because of the regulations. And the new tower space planning has moved along quite well, and we had done a educational partnership with COC. There was a nursing shortage that was quite serious. We've been making donations to them over the last couple of years, paying for faculty, and we donated a portion of space on the campus to train their nurses coming out of their nursing program, and we think that's been good for the community, and it's been good for the shortage, which has since subsided because of the economy. Oh, I'm sorry, I left you behind. The EKG turnaround for our heart program. It might sound like a little thing, but we serve 62% of the community's cardiology medical needs. Well, everybody who comes in for those services needs an EKG, and if you're not turning those around fast enough, that can be a barrier for your physician, and it causes you to stay a little bit longer. We've fixed that. That's just one of many things that we've changed, and we've expanded our clinical education department. We brought in wound care services on an outpatient basis, and we're going to continue to grow those. Bedside patient station, that is the computer now at the bedside. We connected the 2 hospital buildings, so now you don't have to go outside when you're being transferred, when you improve in your care, and we've accelerated improvement of the patient experience scores. What that is we are part of, like all hospitals, the experience that you have is publicly reported on the websites, and we are now heading into an arena where our reimbursement will also be somewhat predicated, will be predicated on how well we do in terms of your satisfaction. And so we've put a lot of time and effort into that, and now on some of our nursing units we're actually in the top 5% in the country in pain management, and that was something that we've been aggressively pursuing in the last 6 months. So we know when we put people on it and work on it, it can be done, and we are getting it done. So why do all these changes matter? And the reason they do is because this community is aging. It is, yeah, it is. It's no surprise to me. If I put my glasses down, it's because I can't see you without them. But with them. But I want you to know that in the next 5 years, this very important age group of 65% is going to grow by 28%. These are the folks who use hospitals the most. We need to pay attention to that. Now, there's other changes in the marketplace, too. A lot of seniors in our community compared to 5 years ago, but the way that people use hospitals is changing. People aren't staying in hospitals as long as they used to. And so with that, we still have to pay attention to those numbers, age 45 plus in the Santa Cruz Valley, that are going up. But we also really have to pay attention to how people are using hospitals and in the advances in taking care of the community and trying to keep up with those, and that's what we plan to do. This is what I mentioned earlier, our mission and our vision and our values. When I arrived at the hospital, we had a slightly different draft of this. The mission has remained the same in the past 10 years. You'll notice that compassion and excellence is bolded there. There's nothing we're going to do with you, for you, and with your physicians without compassion and excellence. That goes without saying. We decided to emphasize that in our new mission statement. Our vision has changed. It used to say to create the ideal healthcare environment to surpass expectations. And a lot of that had to do with the fact that we were so focused on recruitment and recruiting nurses and bringing the best talent into the facility. Well, we really put a lot of thought into where we need to go and where you probably want us to be. And based on your feedback and feedback from some of our physicians and our board and our employees, especially the staff who's right at the bedside working with you, they said we need to be more patient-centered. The board approved that, and that's where we are now focused all the time in all the decisions we make for you, and that's going to affect a lot of what we do day to day. The values, quality, safety, teamwork, accountability, integrity, respect are very similar to our previous. We added the word safety. It's very important in the hospital setting that we have all precautions in place and are always working on that. And our physicians work with us on that too. New projects. We are adding another operating room, and as part of that, our surgery area is going to be updated. Our waiting room is going to be updated in there, and staff rooms and things like that. And that was a long time coming. The hospital's 25 years old, but we need to update all of the areas. The NICU is going to be ready by December. That's the neonatal intensive care unit. That's for moms who are high-risk moms. And in our community, we do have a lot of women over 40 who are having children. We want to be ready for them. And that's an area, unlike in cardiology, where 62% of the folks in the community come to Henry Mayo. In the arena of maternity, that's not so. And there's no reason why you can't have your baby close to home. And not having the NICU has been a barrier for women. And so we are taking care of that. And we will have private rooms in this new building that we're putting together. Spine and joint program is in progress. We've got a nurse navigator who's going to follow you and follows you today from before you have your surgery all the way through and until after. And is always there to answer your questions and help you with pain, in addition to the nurses that are already on the unit in our surgical nursing unit. And the design for the facility is well underway. I'm going to show you here just real quickly. Can I carry this? Oh, thanks. Okay, right here is McBean. This is a little sliver of the main hospital. If we can show it on the big screen, it might be easier for folks to see it on the, and if you can't, that's okay. This is the main hospital, and this is the pavilion. So these are facilities that are already in place, and this is a corridor that we built to connect them. It's up to all the same standards of the hospital in terms of the regulations in California, and was a major addition, making this all one hospital. What we needed to do is we needed to add more beds. With the aging community and with the new programs and centers of excellence that we're putting into place, we have to have enough beds for this community regardless of where you live. This is going to hold up to 120 beds. The whole facility overall is going to be about 358 beds, and there's going to be private rooms in here. And I mentioned competition earlier, and one of the things we know that you want is we know that you want private rooms, and we're going to try to make that happen, and that's currently the plan. What we need to do next is we need to fund the building, and and we need to plan some of the other areas that are inside. But we are going to have one unit that's going to be the new maternity unit, and there's a lot of women in the community and families that are really excited about that, and we're excited about it too. So. This is how it looks so far. You guys are the first to see this particular model in the community. We've shown it to our physicians, and now we're going to show it to our staff and our neighbors. And I'll go back to the slides. Oh, yeah, we'll go back to it. Great. Okay. Changes or challenges due to reform. So you know this is coming up. These are areas that we need to pay close attention to, that we are already working on. We know that reimbursement for us is going to go down. We know it's going to go down for our physicians. So we are working very hard to be more efficient. We think this is going to have benefits for you too, though, because there's no point in you getting anything that you don't absolutely positively need in the hospital or staying any longer than you need to. So cost and reimbursement are going to be long-term challenges under healthcare reform that we and other facilities are going to prepare for. And complexity of public reporting. That's great, thanks. Complexity of public reporting. You've probably seen some report cards on the website. I know, for example, in 2007 in California, there was a survey done of California residents, and 22% of them said that they actually go online to look to see how their physicians are rated. And then 2% of them have actually changed physicians because of what they've seen rated. Well, hospitals are being rated also online. So we know that the public reports are something that people are really learning about, but there's quite a few of them, and they're very complex. And some you pay to get access to, and some you pay to learn about from the hospital standpoint in terms of how you're measured. So they're all a little bit different, and what we'd like to see in the industry is more standardization, and we think all of that is going to become a little bit easier, we hope, for the public, a little bit more accessible and easier to understand, and then a little bit more transparent for everybody. But where everybody is sort of adjusting to the idea of having everything about them in the public. Physician requirements. Physicians are having to invest in IT technologies they've never had before, electronic medical records. and being evaluated by their own patients, and then also trying to learn to work with hospitals in a new environment, moving forward. So that's why we have so many conversations all the time with the physicians that we work with. They're extremely important to the hospital as they are to you, and we want to make sure that they are successful under reform to the extent that we're allowed to do that. And so we'll be working together. And then post-hospital accountability, this is something that's very new in healthcare reform. One of the things that's going to happen is if you leave the hospital and within 30 days you come back, the likelihood is the hospital won't get paid for that visit, and that is something that we've never actually been responsible for. What happens to you after you've gone home? So we're now looking into how do we work with physicians and with consumers to maintain those healthy lifestyles so you don't bounce back into the hospital unnecessarily, because we're now responsible for that. And we've never had to be before. So we're going to learn about those things and make those things work in the next couple years. But I have to tell you, in most cases, we don't yet know how we're going to do that. In the next 5 years, these are some of our goals. These are goals that are in our strategic plan. Really, a strategic plan is only as good as its execution. So we've got a lot of hardworking folks at the hospital right now working to support a culture that attracts, retains, and rewards high-performing, patient-focused professionals. So there's that patient-centered care that we're always working on. We talk about this every morning in huddles at the hospital. Every department talks for a few minutes about some of these goals and how we're going to do a better job serving you. We're producing operating income and funding to meet service and capacity targets, basically making this building happen for you, bringing in new services, bringing in the best possible technologies, and attracting physicians to our community to work with you and help you with your health needs. So we need to provide physicians compelling reasons to partner with us to deliver the best patient care. And some of those strategies are still under development, but like I said, under healthcare reform, where we're going to be working with physicians more closely in post-hospital care, this is going to be important. And facilitating people and resources to come together to meet critical unfunded healthcare needs. It's actually been changed to critical healthcare needs, and that's really working with other partners in the community. For example, Northeast Valley Health Corporation is now having their customers are delivering babies at our hospital, and we hadn't had that before, and that was thanks to relationships they've built with our physicians. So a lot going on. I hope I didn't talk too fast. I know I skipped a couple slides. I apologize for that. I want to answer any questions that you have about the hospital or any questions you have about where we're going.
Cedars-Sinai all the way to Bakersfield Heart Hospital, and had the occasion to use Henry Mayo twice in the last 45 days through the ER, paramedics and ambulance and everything else. And I can see improvements in just the last 45 days. It's really remarkable, and there really isn't any hospital any better, really. It's really come a long ways. Thank you.
Thank you. I would thank my nurses and physicians for that. That really meant a lot. Thank you. I'll tell them you said so.